Good morning, everyone. I am pleased to have this session as part of Ajman University anti-smoking campaign on the occasion of the World No Tobacco Day on 31st of May. We are launching an anti-smoking campaign. As you can see, we have some flags. I don't think if you can see them. So we are launching an anti-smoking campaign to encourage people to quit bad habits. And we have a special guest with us, Dr. Mohammed Saifuddin, who is a pulmonologist at Thumbay University Hospital. Dr. Mohammed deals with special and rare illnesses that affect the lungs and respiratory disorders, and I'm sure he would explain more about his area of expertise. But before I give the floor to Dr. Mohammed, I would like to ask Dr. Fidda to also tell us a bit about this anti-smoking campaign at Ajman University. Dr. Fidda.
Yes, just thank you for arranging my camera. Assalamu alaikum. I don't think I am so pleased to be part of this. Thank you. It's a great event. It's a great awareness session we are having. And of course, our guest, Dr. Mohammed, will give us very, very nice hints to be shared with all people. And EHS office, Office of Medical Services, EHS office, we are working very hard to try to give our best hints to our students, to our community in general. And we'll start today with Dr. Mohammed from Thumbay University Hospital. We are pleased to have him. He will explain to us, I'm sure, a lot of things. And then all the week, we have many other activities will be shared with AU community, and it will be shared later. Ajman University Medical Office will be there, and we have many things to provide. Inshallah, you will enjoy, and we will learn a lot today. Thank you so much.
Thank you, Dr. Fidda. Dr. Mohammed, the floor is all yours.
Yes. Okay. Hello, everyone, and good morning. First of all, thank you for giving me this opportunity to talk about what we call it as a bad habit, smoking. And I think the Ajman University, with cooperation with Thumbay University Hospital, to give me this very nice opportunity to talk about the smoking habits and the risk of smoking, which is the impact in our life of smoking and different type of smoking. So actually, it's gonna be like a brief talk about smoking. It's not that deeply, but we're gonna talk about the smoking in our life, and how we're gonna talk about smoking beyond the smoking, what's happened, not what we know in the street actually. So I'm gonna start my talking. Smoking, as you see now is in the first slide, it is a preventable. So that means you can prevent, or you can save your life, or you can, run away from all comorbidities, from all the complications from smoking that don't smoke. But when you start smoking, and if you continue smoking, definitely you're going to face a lot of problems, especially in the lungs and in the heart and in some part of your body. So smoking, it is a very easy treatable habits. If you, from beginning, the advice is very easy to be obtained from the beginning of life. So don't smoke, so prevent yourself. But when you smoke, then we have a lot of consequences of problem that time. That's why I love this talk, which is smoking is the #1 preventable cause of premature death. Yeah. So let's talk briefly about the risk of smoking and the benefit of quitting, actually. But let's talk about the risk of smoking itself. So if you see, this is a two picture about one of the healthy lung in the left side, and this is a smoking lung in the right side. So obviously, it's showing that the right lung is totally damaged. And if you see also the heart is big in the right side, and the left side appear in the normal normal size. And it will be pinkish in color. Here it became pale, and the lungs became blackish in color due to the CO. And the left lung, it is pinky because of the well perfusion blood. So when I see this picture, actually, I feel sad when I see one people, any person in front of me smoke. So whenever I see him smoke, I put this picture in my mind. So what's going to happen in his lung if it's going to reach in this way? So this is a very bad picture. So when we smoke, if definitely you know what has happened, and a heart attack is nowadays running in the populations. So all the patients who they have a heart attack, we see them, they are like more than 80% they are smoke rather than, and there is other comorbidities like the diabetes and hypertension and high cholesterol. Also they touring giving a heart attack, but smoking is the most common triggering factor for the heart attack. So who they smoke, they have more than 3 times greater than of non-smoker to have a heart attack. So it's believed that definitely yes, the smoking is related to the heart problem, especially the arteries. They will block due to the block of the plaques that block the arteries with supplying the heart, and this is triggering by the smoking. And number one, yes, smoking they have related for lung cancer. Sorry about this. Yeah. So how there is a lot of people, they have lung cancer, but they are not smoker. We see a lot of people, they have a lung cancer, but they are not smoker. But who they haven't smoking, they have a high rate to develop lung cancer. So if we're going to talk about lung cancer, so different types of cancers, what is happening actually, it's when you smoke, you're going to change your cell architectures actually. So especially in the airways. So we see a lot of people who they are smoking, they have chronic wet or productive cough. And the problem with that is we have, if we are going to talk about scientifically slightly, we have the major airways and the small airways. So the big airways, they don't have, they have a lot of goblet cells, which is secretion for humidify the airways. But the small airways, they don't have this kind of goblet cells. But when you smoke, there is a goblet cell going to form it in the small airways. That's why you're going to have a lot of secretion and your oxygen coming down, because the small airways is very easy to block and to prevent oxygen and CO2 to be drained. So, and this goblet cell, whenever it's formed, when it develops with the smokers, so that means there is a chance to be from the benign to be malignant cells actually. So a lot of people also they have genetic they have a genetic problem to develop lung cancer, but the trigger for that also the smoker. So the smoke, if you smoke and you have a high threshold for developing lung cancer, you also increase the percentage for developing lung cancer. So this is how we think about the lung cancer patient. Yes, COPD, it is now became a third common disease, high mortality after the heart and the cancers actually. So when we talk, when we say COPD, it is a chronic obstructive pulmonary disease. So here a very bad word is said here is chronic. So chronic, that means it's a long time. So when you smoke, like we're going to talk about, when you smoke more than 20 or 25 years and you are a heavy smoker, you're going to develop this disease. And actually the disease actually came with difficulty breathing, a chronic productive cough, a high rate of infection and exacerbation. So your lifestyle is going to be changed. So you cannot reach or you cannot enjoy your life with the family if you cannot catch your breath. So this is the problem with the smoking. And it's also, this kind of disease, it changed the lung architecture. So that's why when in the beginning of the slide, we say it is a preventable. So if we stop the smoking or if we stop as early, as soon as possible, definitely we gonna catch up the disease. So this is one of the challenging disease that I'm facing in my clinics, COPD. So when they stop smoking, so I encourage them to stop smoking definitely. still they have disease and they smoke. So the problem here also they don't encourage themselves to stop smoking, but this disease is very bad, and they end by a home oxygen. So they have a lot of complications and they have a lot of morbidities happen. So so the smoking, it is really a killing habits actually, but it is a progressive killing habits actually. Yes. Yeah, so at the same, like in the heart attack, so strokes, what's happening also, there is a block happening in the blood supply that feeding the brain, and or it can be ruptured. So smoking also is triggering this kind of disease, which is called cerebrovascular accident, CVA. So whatever it is hemorrhagic, as you see in the picture, or whatever it is ischemic, so it is block of the blood supplies. So if you see this picture, there is plaques here in the blood supply. It's the same that we found it in the heart attack in the coronary arteries, who they are smoking a lot. So also this kind of patient, when they have the stroke, so they end by, paralysis, left side or right side, or totally paralysis, because you affect the CNS where they are feeding your limbs and extremities. So also they have poor quality of life. So smoking, actually, it's a very bad habit. So also you can have the colonic cancer, the brain cancer, the bladder cancer, kidney. So what's happening to smoking? Actually, it is change as I said, it changed the architecture of the cells, which can be toward to the malignant or very nasty cells that causing the cancers. So people, please, smoking, this is very, any type of smoking. So any type, whatever you smoke, the vape nowadays, or you can smoke what we call it shisha, and the normal cigarette smoke. All of them, they have the risk for developing all this kind of factor in our life. So it is, yes, it is a killing disease. It's a killing habit. So at least whenever you stop early, you're not going to fall down like these people in the picture. So if you stop late, you are late actually. So that's why we said it is a preventable habit. I want to talk about vaping, but it's very short talk because some people, there is wrong thoughts about the vaping. So I have a lot of patients, they come to my clinic, they said, I shift from smoking, now I do vaping, and actually it is worse. So vaping, it have a lot of complications. So vaping, that means you burn your airways and your lung tissue actually by heating. So when you burn, you injure your blood vessel there, so you end by coughing blood. So I think a lot of people who they are using this kind of electronic cigarettes, they're facing this problem of coughing blood and sometimes dryness of the throat, and some undesirable feelings in the chest actually. So, and I have a lot of patients, they've been admitted with me in the hospital, they are coughing blood because of this vaping and new electronic smoking. So we call it now, it's vaping related lung disease. They have also different manifestation and they have own textbooks actually. And it's a very nasty, dirty habits also. So at the end, actually, the lung is built for air. Is never ever built for smoking or vaping or anything. So because they have a normal physiology for taking the oxygen in and taking the CO2 out. So whenever you introduce something rather than air, you're gonna mess up between these two elements. So the lung is building for air, please. So this is a diagram actually, whenever I have patients in my clinic, and especially the COPD patients, and I start to try to encourage them to stop smoking. It's very difficult, who they are smoking very long time to stop and to accept the thought that I must stop smoking. So a lot of people, they come there they hear my advice from the right ear and they throw it out from the left ear. So I try to change in my practice how I'm gonna stop the smoking. Yeah, smoking cessation, actually there is a principles. There is a lot of questions and there is steps for smoke cessation. And still that also I facing a lot of difficult to encourage them to stop smoking. So I give this diagram. Actually what it show that on the left side, this is the lung volumes. We talk about FEV. Actually, this is one of the parameters we do in the lung function test who they are smokers. So we measure the FEV1, which is the amount of air coming out from the lung in the first second. And this is the age per year. So actually, normally, who they are before 30 years old, and after 30 years old, normally we losing about like 15 ml of our lung volumes annually, more than 30 or 35 years old. But who they are a smoker, more than 30 and 35 years old, who they are a smoker, they're going to lose annually 140 ml from their lung volume annually. So it is very huge number. They did a study there and they found this: who they are smoker, annually they losing 140. Who they are non-smoker, annually they will lose 50 as the aging process, 50 ml from their lung volume. So this is very big difference actually, and definitely you're going to have the symptoms very soon. So here, if we always, I show my patient this picture. If you see here, so let's talk about you start smoking from 25 years old, and you start losing your lung volumes down and down and down wherever you go. So for 30, 35, 40, till you reach 40, and still you are a smoker. So till you reach the point that you're going to become a disability. Disability, that means in the general aspect, that means you are not enjoying your life. So you cannot do exercise, you cannot catch your breath like in the same age of your friends. You cannot do anything without, suppose you have an oxygen, and this is bad. And definitely the death is going to be very soon, and like before 75 or before 60. So this is a picture I actually explained to patients. So if you stop, suppose like in the 50s, you have a chance to recover, but it's coming down because there is some of the lung, it became damaged, but some of the lung there is healthy. So this is the way I'm explaining. So there is still chronic destruction of the lung. So in the end of the point, actually, this is not really, this is approximately picture showing in some patient who they have mild and severe COPD, they will die like that. No, definitely the death and life is depending on the God. But let's talk about science, let's talk about evaluation of the patient, let's talk about how to help the patient to stop smoking. So we put these figures as approximately what is happening. So whenever you stop and like almost reaches a point and you stop here, still you have time. So whenever you stop early, the picture is whenever you stop early, you have a better life early. So whenever you stop early, you don't have complication, you're successful, you're going to feel fine, you're going to enjoy with the family, you don't have to use the oxygen, you don't have to use there's some kind of machine, you can use it at home to wash out the CO2 from your lung. And this is the poor prognosis patient reaching this point. So actually this, for me, I'm using for showing the patients, it helped a lot, but it helped a lot to patient to quit smoking. So quitting is one of the challenge for patients who they are smoking for a long times. It's a very big challenge. So when you quit, definitely encourage yourself to have a healthy life. So if we see here, for many people smoking, there is two things. If you want to smoke, so if you want to stop smoking, it's very difficult. But there's two reasons for that. So we know the craving and habit. So craving, that means you have a very strong want or need for the cigarette and feeling unsettled when you don't have one. So that means when you stop smoking and you need to smoke again. So you're going to go to smoke again. So you have this kind of a craving, what we call craving. Yeah. Habit, it's a habit. So doing things the same way over when you smoke. So it is a habit, but it's not a craving. And this kind of people, who they have this habit, it's very easy to stop with smoking. But who they have the craving because they want it, now we facing challenge with these people. So this is why it's very difficult for that. So So this guy here is habiting, so he's doing habit, but that he's craving. So whenever he smell nicotine, he start to light it again. So the problem is, who they have is difficult smoking. What's happened actually when you smoke, the nicotine is delivered by smoking and then go to the blood supply and it's reached in your brain. So in the brain here, there is a nicotinic receptor which stimulate the release of dopamine. So dopamine is one of the enzymes and hormones that it give you a pleasant and calmness. So when you smoke and you have increase of dopamine, you find you can calm, you feel pleasant, you enjoying the smoking, and maybe you forget all the negative things. You feel happy when you smoke. So when you stop smoking, the dopamine levels come down. So here's the problem. So when the dopamine come down, you have the withdrawal symptom. I'm going to talk about later on. So withdrawal symptom like stress and anxiety. So what you're going to do again? So the withdrawal triggering you to desire to have another smoking. So this is a cycle, what's happening. That's why the people, it's difficult to stop smoking here. So they use the nicotine, they increase the dopamine, they feel pleasant, they calm. And after that, they stop smoking. They want this calmness again, they feel anxiety, they start smoking again. So it is a very bad cycle, and we are trying to stop the cycle from here to stop smoking. And what's happening here is challenging actually. So whenever you stop, so this is the withdrawal symptoms. Any people, they have their own different symptoms, their own phenotype of symptoms. So anxiety is number one, sleepiness, difficult to concentrate. Some people are saying, yeah, whenever I stop smoking, doctor, I'm gaining weight. Yes, I agree with that. Yeah, but there is a way to decreasing weight by doing healthy things, which is exercise and eating healthy. You can do that. So we don't want to take this as a negative mark of, if I stop smoking, I'm gonna gaining weight, so let me continue smoking. So no, so there is a different way. So don't take that as justifying that I must continue smoking. Fatigability, sadness, so a lot of symptoms, a lot of withdrawal symptoms they have. So definitely when they feel this withdrawal symptoms, they go back and smoking again. So here we facing the problem, difficult to encourage them to stop smoking. So a different way. So a lot of people, they are using nicotine replacement therapies like nicotine gum, patches. There's also nicotine inhalers, and there is one of the medications, the papaverine, which is now, it is useful a lot of countries outside, especially, but it have side effects, psychological side effects sometimes, and the CNS side effect. Actually, a study is done about all these therapies. The outcome of that is not that much promising, actually. So the promising is to encourage yourself to stop smoking. Actually, in my practice, and I don't use that, this all because I think it is costly. So I'm trying to encourage changing the habit, changing the lifestyle, doing something more to stop smoking. And we found that if you want to stop, so I told him that this is the way I'm talking. So if you want to stop, so tell your friend and family about your quit date. So encourage yourself. Suppose now you're going to stop smoking after 3 months. Yes, do it. So give them a good date and talk to your family and your friends about that. Why you include your family and friends? Yes, they're going to support you in that time. They're going to remember you. Oh, you're going to stop in that time. So try and encourage, don't disappoint them. Yeah, I'm going to stop in that time. Yeah. So ask them to understand that you need to change your habits. Yes, actually, if you have a friend, they are smoking like you, that means you're not going to change your habits. So at least you use who they are not smoking friend and family, they're going to definitely our support in our life, all our life, it's the family, father and parents. So they're going to support us whenever what we have. And ask them that if you don't quit, so I'm sleep up, so I'm not your friends or I'm not a part of family. So give some point that you're gonna facing a problem if you don't stop smoking. You're not gonna have friends, your family is not gonna support you. Definitely gonna support you, but at least point yourself, encourage yourself to stop that. Okay. So then, so that's why quitting is a journey. It is not an event. So it is not like suddenly happen. You cannot smoke for more than 20 years, 25 years, you're gonna stop right now. It's difficult. So it is journey stop. So suppose you're smoking like 20 cigarettes per day. So after 1 month, you're going to smoke 10 cigarettes. After next month, 5 cigarettes, 1 cigarette, and then stop. So that's why it's a journey. So journey, that means you're going to facing struggling. So your life, you're going to face a struggle to stop smoking. So it is not that event. But if it is happening as events, so it's, I feel happy, definitely suddenly stopped. I have a lot of patients, they admitted with me, they stop smoking the day of admission. And when I follow them after 1, 2, 3 months, they stop smoking. So it is very nice habits happen to stop smoking. But again, it is a journey. So yes, you're gonna face a lot of problems. Put a time, pick a time for quit. Whenever you put a time, so put a date. I mean, booking a date for the quit. Whenever you book a date for quitting, yes, I guarantee you're gonna stop smoking and use all the modalities till you reach in that date to stop smoking. Actually, thank you for this opportunity. So I just talk about smoking in slightly scientific way and in, you know, in a habit way, because I'm talking generally because smoking, it is one of the I'm facing problem in my clinic. So I make it shortly, more simply, and the floor is open for the question, if you don't mind, and thank you for this opportunity.
Thank you very much, Dr. Muhammad, for this insightful and helpful presentation about the dangers of smoking. There are many things that you have mentioned that I knew for the first time. And I'm sure a lot of the other participants appreciated what you have said. We will open the floor now for your questions. If you have any questions, feel free to either raise your hand or you can type it in chat in case you don't want to speak. So now it's your chance if you are a smoker, it's your chance to ask more questions. And if you are not a smoker, I salute you. And okay, we have Dr. Ala Bibi Krishma. Okay, please go ahead, doctor.
Good morning, doctor. Thanks for the fruitful lecture. Doctor, can you ask just advice about the pregnant ladies? Actually, their craving of the smoking became more while they became pregnant. Yeah. And you know, the hazardous is more for the baby. So how can we stop them from smoking? And you know, all these propione and all these drugs which they are also contraindicated in the pregnancy.
Yeah, this is a very nice question. Yeah, this is a very challenging also. Actually, we see a lot of pregnant ladies, they are smoking, and despite they don't take care of the risk of the babies. And again, it is the same. People who they are smoke, it's difficult to stop smoking. But here's the problem. So let's talk about in the practical way. Who they are smoking, at least the way of, as a doctor, we are. So we don't want to make an order to advise smoking. So when you give an order with the patient to stop smoking, is they're going to take it from here and take it out. So at least you have a discussion with the patient to know why you are smoking. So there is a principle of smoking. So you're going to ask question why you are smoking. If you have your family, any part of your family, they are a smoker. Do you know the risk of a smoker? So at least introduce yourself inside the patient. Let the patient give you what they think about smoking. And here, when you take this point, definitely you can stop the smoking. It's very high risk to pregnant lady smoking, and all this medication, the propione, all this medication, actually it's a side effect, and they have a lot of side effects, especially in pregnancy. So I also, again, for myself, I told you I never use it, but I'm using my way is to communicate with the patient. Our practice now is, rather than to give medication, no, is now changed to communicate with the patient. When you communicate, there is different way of communication. That means be friendly. It's not a communication like you are standing in the office and like you're dealing with him as you're going to give him paper or something like that, because we are dealing with human being. So when you communicate with the human being, definitely you can change their mindset if you have a skill for that. So whenever I see a lot of patients and a different of way they're thinking, I communicate with them according to their way. So be politics with them. They're gonna accept that. It's difficult, yes, some people it's difficult, but try your best to go inside their brain. They're gonna accept what you're gonna say. Pregnant lady, I think they are the easy persons to be changed or stop smoking, because yes, the dopamine and everything that is happening, but it's very nice to communicate with them, because they have a child gonna raise him and they're gonna see the future of this child, what's happening. So they don't want to see a child having problems when it came out. So for me, the communication is better than everything. This is what I see in my clinic. So just try to communicate with them. Actually, it's very easy for them, especially to stop smoking. I'm facing only the men, the old men. Actually, they stick forward. They're not stop. If you don't told them to stop smoking, he's gonna stop me definitely. So they are so difficult to talk with them. But in females, especially in pregnant ladies, yes, it's just communicate with them. They are accepting that.
Thank you, doctor. And the second question is there any difference between electrical smoking and real smoking? Because some patients, they argue and say, doctor, I'm doing electrical smoking. There is no hazardous.
No. So look, that's why I say from beginning, the lung is built for air. So whenever I introduce anything, electrical smoking, vaping, anything, so it is danger for the lung. How the lung is manifestation for the electric or for simple cigarette smoke is different. So for electrical smoker, actually, it's in by damage of the lung tissue, the small lung tissue. So we call it, the name is, we call it interstitial lung disease. So it is one of the type of interstitial lung disease, and we have more than 200 or 300 interstitial lung disease. So now we put something called vaping or electric smoking or vaping related lung disease. So this is a big subject. So it have a lot of complication. Sometimes patient ending in ventilation actually, because the lung filled with blood. So they damage the small blood supply, and it is open in the alveoli, and the patient coughing blood, and they feel like grunting. So the oxygen is stopped. So we end by intubation and ventilation to the patient, and sometimes the outcome is bad. And sometimes the outcome reaching to something called lung fibrosis, which is also again ending by oxygen. So I have young people, they are on oxygen because of the vaping or electrical smoke. But this is the wrong thought. People, they think that I'm doing electric or vaping is better than simple cigarette. The problem in this electric or vaping, it's create heating more than 3,000 centigrade. I think that this is what I know. So it's burning the airways, all the airways. That's why some people, they feel like dryness in the throat. So they're burning the airways, and sometimes reaching the burning to the alveoli, and the patient ending by coughing blood. So it is, I think it is dangerous rather than the smoking. Yeah, in my point of view, when I think it is more dangerous rather than the smoking. About what I see in patients come to my clinic. But again, both of them, they are dangerous. So both of them, they are harming the lung, they are injuring the lung, they are ending of what's called fibrosis and a lot of manifestations. So all the vaping, any kind of inhalation, I prefer to advise to stop it. Actually. Yeah.
Thank you, doctor. Thanks a lot.
Thank you.
Thank you very much, doctor. We have a couple of questions on chat, and we also have Ibrahim, who raised his hand. Let's start with Ibrahim. Ibrahim, are you ready to ask your question? Please go ahead.
Yes, thank you very much, and thank you, Dr. Muhammad, for this interesting presentation. Actually, I have two questions. I'm Dr. Ibrahim Sarfi from College of Medicine, Ajman University. My first question is, how about someone who is like smoking very randomly, like once per week or once per month, or just when he's meeting friends or something? And the second question is, usually one of the ways to fight smoking is to put a lot of restrictions. So what do you recommend, like, for example, if you have some building, of course, no one is allowed to smoke indoors, but how distance or how far should go away, or like open areas or away of like other houses to smoke, to just to avoid passive smoking and to push the person to stop smoking or to reduce smoking.
Yeah, it's
Thank you.
very nice. The habits actually smoking one per week, one per month. Again, it's harm the lung. So I think we have a lot of diseases that in the beginning of smoking, you start to develop the disease, like some kind of vasculitis, we know that. So suddenly the patient is recently smoking, he developed the lung problem, he developed hemorrhage. So some people know they smoke for a long time, but they don't have disease yet. But again, I'm going to say the smoking very long time, like every 1 week, 2 weeks, 1 month, again, it's a risk. Yes, it's not like the same who they are daily smoking 10, 20 cigarettes a day. Yeah, it's different. The risk is more in this kind of this group, but who they are smoking occasionally, they have also the risk of developing any kind of lung manifestation, but maybe in the long time. So again, this is an advice to stop. So as I say, it's preventable. So whenever you prevent as soon as possible, you can prevent all the problem after that. Restriction of stop smoking, so we see when you put some flags, stop smoking here, go to the smoking area there, or don't smoke there, it's also helping. But at home, they will smoke. So there is no restriction at home. So when they're facing a restriction outside the home, so they're not gonna smoke and they for urge and craving to smoking a lot. So then when you go to at home, they're gonna smoke like 20 cigarettes per hour. So I agree with restriction because of passive smoking to don't harm to other people who they are not smoking. Some people it can harm themselves. They're gonna go out back home or in the washroom. They're gonna smoke a lot because they're gonna release more dopamine and they feel present all the day till reaching at home and they smoke again because of the restriction. So it's different. So restriction, I agree with it. Yeah, because it must help the people who they are passive smoking. Yeah, but what about who they are a smoker and how we fight with them? So this is again, I'm gonna come back. Please, always in the medical practice, always whenever we practice in medicine, anything. I'm not talking about smoking. That's what we talk about. If you want to advise a patient for do something or take something or take medication or something, we need to communicate these people. These people, they are very easy to be changed their life by just talking with them. We follow the guidelines. We follow what is written in the guideline. Yes, I agree. But now I agree in the communication. Actually, when you communicate and when you see the patient concentrate with you in communication, and the way of communication is also changed, and the tone of communication also changing the reception, what you're going to receive from you. So whenever you have very nice communication with the patient, definitely he's going to change, or he's going to think that about, he's going to stop smoking, actually. Yeah.
Thank you very much.
Thank you.
Thank you very much, Dr. Ibrahim. I'm going to move to the chat section. Yeah. We have a question from Hadil. Sorry. Hadil says, is there a facility or institution to provide smoking cessation program service and follow-ups here in UAE? Because as you said, it's not just nicotine patches or gums, it needs also psychological support.
Yes, I agree with that. Yeah, definitely. You need a psychological support in the smoking cessation system. I think, I don't know in the UAE, but I think in, the which I know in Rashid Hospital, they have, actually, I don't went there, but some friends, they told me that they have a department of smoking cessation, which this is what I know. But yes, we must include it because psychological, because who they are smoking, they may have psychological problem. That's why they are smoking, to relieve their psychological problem. This is a very good point to also to stop smoking, because that if you don't know what is the problem, the patient, why he smoke, you cannot deal with the smoking. But I think there is a department of smoking cessation in Dubai, especially in Rashid Hospital, but there is also a private sector. He working the smoking cessation. I think it is an Al-Ain, but unfortunately, I don't have any contact with no of them. But there is, yeah, definitely there is, yeah.
Thank you, doctor. We have another question from Usha. Can passive smoking increase in heart disease and blood sugar those who are already under medication?
Yes, yes, definitely. So a passive smoker. Yes, yeah, definitely. Passive smoker. So what's happening to passive smoker? They smoke. What I mean by passive, that means they smoke. So they inhale. So are the same with a smoker. So the word of passive, I think I want to change it to also smoker. If you sit with a friend and they are smoker and you are just sit with them and chilling, yeah, it's not like when they smoke. But any patient who they have comorbidities, diabetes and hypertension, and they have passive smoker, or they are not smoke, or they are smoker actually, they have a risk factor to develop vascular problems. Yes, so because again, if they are passive smoker, 70% they're going to end by smoker. So they're going to smoke because the nicotine is coming inside and they have the dopamine again. So they're going to encourage themselves to go and take a cigarette to try it. And then the catastrophe happen. So yes, they have a problem also.
Thank you, Doctor. We have another question from Isra. When is it recommended to medically intervene with medications when it comes to smoking cessation?
Yes, here, here definitely. If the patient actually he wants to encourage himself, but he cannot, and if you're facing the patient, he need to stop smoking. Definitely now you can interfere the medication, especially the proponion or nicotine gum or nicotine patch or nicotine inhalers. I think you can introduce that. The problem is of this kind of medication, they have also withdrawal symptoms, but they have less complications. And but if you feel the patient is willing, really willing to stop smoking, but he can't, definitely here you're gonna try the medication actually. And I never tried that much, especially in Sudan. We try, but not that much. But here, mainly I do communication. I don't try this kind of. I don't try this medication actually. But yes, if they're willing, definitely you have the right and you have the green card to try this medication on the patient who they are willing. Because if they don't willing and they're going to try it, they're going to return back. So after 2 weeks of this medication, they're going to come back and smoking again. So benefit from this medication is useless actually.
Thank you, Doctor.
Thank you.
Does anyone else have a question or needs to talk? While we wait for more questions, I have a question for you, Doctor.
Yeah, okay.
What advice would you give to people who smoke shisha and try to convince you that it's not as bad as cigarettes?
Okay, this is a very question. People who they are smoking shisha. I have one patient actually, he come to me and I told him, do you smoke? He said, no, I'm just doing shisha. So I told him, it is a smoke also. He said, no, shisha, there is no nicotine, not nicotine in the smoke. So he tried to justify the shisha that is not harm him. And because so I told him, okay, but there is a smoke came from the shisha and you take it out. He said, yes. So this is what I don't want it, whatever is include nicotine or not. So yes, it is one of the burning lung disease, one of the increased CO in the lung, and it is enhancing an inflammation in the airways. And the end point of shisha is the same of a smoker. Okay, and the chronic cough, the chronic productive cough, what's called chronic bronchitis. Okay, and yes, they are the same effect. There is no difference between shisha and smoking. So again, I'm going to tell you, your lungs is built for air, is not for shisha and smoking. So yes, they have the same effect. So see, so this is a, sorry about that, but this is a question that I face in clinic. They try to get something to get blessing. So, okay, we're going to quit smoking. So let's go to vaping. So I'm going to quit vaping. Let's go to the shisha. So I'm going to quit the shisha. I'm going to go to another electronic. So they try to run from the name of nicotine to smoke something else. All of it, it is harming the lung. So try to don't give an option for the patients. Try to restrict him here. And when you communicate with him, no, this is all of them, they are the same. All of them, they are making problem. All of them, they are making lung problem. So don't do that. Try to stop after 2 months, try to step down the smoking after 2 months. Yeah, you can step down to, okay, I'm gonna help you. Step down from smoking, do vaping, but at the time of after 2 months, you're gonna stop vaping and cigarette and everything. You can't do shisha till in that time, you're gonna stop. Because if you're not gonna stop, we're gonna have a problem. I'm gonna give you oxygen. You're gonna have this kind of problem. You're not gonna face enjoying life with your family. So this kind of question, try to restrict the patient side by side. Don't give him opportunity to get out from that. So the same shisha, it is the same smoking.
Definitely. Thank you.
Yeah, thank you.
We have one more question, doctor.
Yeah.
From Dr. Fidda. Other than nicotine, can CO from the smoke lead to the same health issues?
Other nicotine than CO?
Yeah, Dr. Fidda?
The carbon monoxide, doctor, from the smoke.
Yeah. So can you repeat the question? What do you mean by the question? So can you just ask it again, please?
Yes, because we are running one activity where we check the carbohydrohemoglobin.
Yeah.
And then we want to know the excess of CO in the blood. What would be the effect on the health of the smoker?
Okay, now I get it. Yeah. So the excess of CO in the blood is have a lot of issue. So the number one is confusion, the loss of concentration, the effect of the CNS, and in the eye. So some people, they have some problem in the eye. And CO in the blood, they're causing secondary polycythemia, as we know. So it's causing headaches, causing fatigability. So CO is a toxic, it's a very toxic gas, and it is having, as you know, doctor, is having a high affinity to go to the blood rather than oxygen. So we use sometimes the CO to measure the diffusion of the lung, the lung function test diffusion capacity. So, but in the very lower limit. But who they are chronic smoker, they're gonna have high CO in the blood. So when they have a high CO in their blood, so they're gonna decrease the affinity of the blood to take on oxygen. So the oxygen is gonna come down in a long while. So they're gonna develop what is called pulmonary hypertension. Okay, they're gonna develop like cerebral edema, brain edema, sometimes confusions, and they're gonna have secondary polycythemia, which is increase the RBCs in the blood, and the increase of the RBCs in the blood causing another issue. So they have a lot of problems actually. CO, we face a lot of problems. They have vague symptoms. Some people, they came with fatigability, brain headache, and they are a smoker, but they don't have any lung issue actually. And they learn a lot of investigation, a lot of imaging, and they don't find anything. So the answer for them, they say that you have a stressful condition, you are fatigued, you're gonna eat some vitamins. No, the problem is to stop smoking also, because CO can cause systemic manifestation. So we do blood CO. If you do also ABG, you see the CO high, you do blood CO, hemoglobin, carbon monoxide is high, carboxyhemoglobin is high. Yeah, so whenever you have this kind, it's one of the targeting to encourage the patient to stop smoking. Definitely, if you stop smoking, the affinity come down from CO and the affinity come high for the oxygen. And I think all the complication, it could be, if it is not at the end of stage, but it could be reversible.
Thank you, doctor. It's very
Thank you.
Yeah. Thank you, doctor. Does anyone else have a question for Dr. Muhammad? Well, I guess that the question session is over. I wish to thank you very much, Dr. Muhammad, and I wish to thank also Thumbay University Hospital for this opportunity and for this very informative session about smoking. And I hope that if we have any smokers among us, that they quit smoking and they know the dangers of smoking. Dr. Fidda, would you like to add anything else before we end the session?
Thank you for this outstanding presentation, doctor. It made things very clear in our minds, and inshallah it will stimulate the decision of many people, smokers, to quit. Starting from today, it will be the nice date to start, I think. Inshallah, next time when we have a meeting, we'll have less people coming about smoking and then telling that halas, they made a decision to quit. And thank
Inshallah.
you for the information. It was very, very nice.
Thank you for that indeed. Thank you very much.
Well, as part of the anti-smoking campaign, we have more events upcoming. So stay tuned to know more about our upcoming events. Thank you very much. Have a great day.
Thank you. Thank you.
That's